Welcome back. Breast cancer remains among the leading causes of cancer death among women. Regular screenings is the best bet for early detection. We've said it often. And according to newer guidelines women should be getting their mammograms earlier. In today's Eye on Health, breast radiologist Dr. Evita Singh explains what these recommendations mean for women now. And thank you so much for joining us. Can you break down what exactly they are?
Well, I just wanted to really go over what the United States Task Force recommendations are that just got refreshed last month. So in 2009, they changed recommendations recommending annual or mammograms at age 50 every 2 years, which was pretty much against what we had been doing since the 80s. Now, last month, they've gone back to saying women do need to get their mammograms starting at age 40. They did recommend every 2 years and an end at age 74, but all of the breast organizations out there, including myself, oncologists, surgeons, really want to emphasize that age 40 every year is really what needs to be done to prevent breast cancer deaths in women.
Yeah, are you all finding that this message is getting delivered, the changes?
It's getting delivered, I think, from some media sites, and we're definitely trying to get the word out there, especially with referring physicians, patients hearing it themselves. Women are their own best advocates, so the more you know about yourself, you can come in. Insurance companies have still been paying for it, even since 2009, at age 40 every year. So we just want to make sure people are not confused about what the best thing to do is.
Right. So why do you think the change if we've been doing it anyway?
Well, a couple of the changes to refresh going to 40 have been that all the organizations, like I mentioned, breast surgeons, oncologists, people who are really specialized in understanding breast cancer, really feel that 40 every year is the best thing to do to reduce those mortality deaths. Secondly, unfortunately, more and more young women in their 30s and 40s are being diagnosed with breast cancer. It's going up at a rate that's more than it's ever been, about 2% every 10 years, or over the last 10 years, which really means that we can't afford to wait until you're 50 to get you in for a screening mammogram. As we know, young women have worse cancers, they have worse disease, and they have a much longer life that they're going to be missing out on if they're not diagnosed early. So we really want to make sure that this was put forward, and I'm glad that they changed it to 40, but we really want to emphasize the every year being important.
Now, this might be out of your wheelhouse, and if it is, I apologize, but if you are an insured woman, can you get your mammogram at 40 if you just so please?
Yes, in the state of Michigan, actually, most facilities don't even require a script, as we were just discussing.
A prescription,
so
yes.
That's actually, yep, most insurance companies, to my knowledge, all of them still are approving every year after the age of 40 a screening mammogram, many even a baseline at age 35.
To clear up some myths, I've heard some women say they put it off because they were afraid it would be painful. They didn't want to get squished in the machine, so to speak. Is that fair, or is that maybe not the truth?
Well, every woman is different, and some people are more sensitive, but there have been really a lot of progress made in the mammogram technology. They're much faster. There's even special paddles where the compression is a little bit of a softer curve. So we're really seeing that experience being a little bit less. If you're really someone who's very sensitive during your hormone cycles, we really recommend you get your mammogram the week after your menstruation cycles so that your breasts are the least sensitive. And also you could take an ibuprofen before coming in if that's really something that you think might help you.
So it's very simple tactics.
Yes, and it's a very quick exam. I had it done myself. I was really very surprised that it wasn't as painful as I thought it was going to be.
Good. See, good to know. Dr. Singh, thank you so much.
You're welcome.